Dr. Amesh Adalja joins us now. He's a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. He is in Pittsburgh. Doctor, good morning.
Hello. Today I present to you an extremely attractive application for music lovers. It's completely free. You can listen to music online or download unlimited music to use whenever you don't have internet. The powerful search function helps you find anything you want. Trust me. It's hard not to find what you're looking for because the search function is really powerful. Application download link is attached in the description of the video. I'm pretty sure you'll like it. Thanks.
Good morning.
Good morning. Thanks for having me.
So we know that this third shot is now authorized for people with compromised immune systems. The question is, what about everyone else, doctor? Does it look like others may soon, be in that category where a third booster shot may be beneficial?
In the short term, it's not likely that we're going to see boosters for the average healthy person that's fully vaccinated. To me, the threshold for needing a booster vaccine is to see breakthrough infections landing people in the hospital. And that's just not happening. The vaccines are holding up tremendously when it comes to preventing serious disease, hospitalization, and death. So there may be a time down the road where we need boosters, but I think it's premature to think about that for healthy individuals at this time.
When we look at part of that unvaccinated population right now, it is kids under 12 still not able to get the vaccine. Just coming in this morning, one of the things I heard is that it looks like now winter time for those that are under 12. Can you give us an update? Where are we with kids, and why does it seem to be taking so long?
Well, the clinical trials are still going on, and you have to remember a couple of weeks ago, the FDA asked to expand those trials to be able to pick up any rare side effects. Anytime you give a vaccine to someone, there's a risk-benefit calculation that needs to be undertaken. And it is true that children are spared from the severe consequences of disease. So there is a different risk calculation when you're vaccinating a 10-year-old versus when you're vaccinating a 60-year-old. And that's what we're trying to do with these trials, to understand where that risk-benefit falls. And I think parents should realize that children are spared from the severe consequences of disease in general. I mean, it doesn't mean it never happens, but it's rare. And I think we are plodding along with this vaccine. The faster it comes out, the better, but we want to make sure that people have confidence in this process, that it is a safe and effective vaccine in that specific age group.
And do we have a sense when that, I know, as you say, they are getting that all the data that they want to find, but do we have any sense of when we may see kids being able to get this?
Likely late fall, early winter for that age group of 5 to 11, and then even longer for children under the age of 5.
Doctor, what do you think you talk about fall and winter last year. What is this fall and winter going to look like? Because I think in May and June of this year, a lot of people thought we were getting to be done with the pandemic. Now it seems that's not the case.
Our fall and winter are really going to be dictated by how many people get vaccinated, how many people get infected during this wave of the Delta variant. We know that coronaviruses accelerate their transmission when it gets colder, when it's less sunny, when it's less humid, when people move indoors. We know that we're going to be contending with other respiratory viruses. So unless more people get vaccinated, unless we get a handle on the Delta variant, we're still going to get disruptions in certain parts of the country, just like we are now with COVID-19. So this is something we really have to encourage people to take seriously and get vaccinated. The sooner the better if we want this pandemic in our rearview mirror.
So, Doctor, New York City became the first city to require proof of at least one dose for certain indoor activities. We know that San Francisco will require both. This is all happening at the same time you have some governors pushing back against mask mandates. What is your take on this?
It's much, much safer to do almost any activity if you're fully vaccinated. And if you're a business owner, you don't want COVID-19 spreading in your organization. And I do think that it's coming to a point where we have to start distinguishing between the vaccinated and the unvaccinated. Because if you're fully vaccinated, the virus is going to treat you very differently than it's going to treat someone that's not vaccinated. So other people should treat you very differently because you're no longer a threat. So I think we're moving towards this unless we get the vaccination numbers higher, because it's just very likely with the more contagious variant spreading that you're going to see Delta variant cases impinging on normal activities that people do.
When you mention that, I feel that a lot of people who are vaccinated with the Delta variant have now started questioning some of the things they were doing. Well, I was going to baseball games and doing these things outside. Should I be wearing a mask? What is your advice when it comes to people who are trying to sort of figure out what should they do and what maybe they shouldn't do now?
If you are fully vaccinated, you can rest assured that the Delta variant doesn't pose a threat to you in the way that it would if you weren't vaccinated, meaning you're unlikely to get serious disease, hospitalization, or death. The vaccines are holding up really well. There are breakthrough infections occurring, and thankfully, because of the vaccine, the breakthrough infections are really mild. This is evidence of the vaccine working. So it really boils down to your risk tolerance. When you're fully vaccinated, most of these breakthrough infections are going to be akin to the average common cold that you get. And if you're somebody that's immunocompromised, that may be something important for you to try and avoid. But for other people, what activity you're pursuing, that risk might be outweighed by the benefits you get from that activity. So it's all going to be risk calculation based on individuals' values and what they want to do. It's not going to be one size fits all. But the vaccine is the best way to make the Delta variant a non-issue for you.
Dr. Adalja, quickly before we let you go, if I can go back to kids for a minute, we are seeing more hospitalized now. And in the beginning, it seemed that kids weren't as affected by the coronavirus. Why are we seeing more children hospitalized and affected right now, especially by the Delta variant?
The Delta variant is looking for unvaccinated people, and it just so happens that people under the age of 18 have a lower vaccination rate, and especially those under the age of 11 who are not able to be vaccinated. So they're getting infected more. Also, children are back to their activities more. They were shielded a lot during the early parts of the pandemic. But it still remains true, even though we're seeing these hospitalizations, that that's not the norm for a child. And I think the best way to protect children is to get more people vaccinated, including all the adults that surround a child. And for those children above the age of 12, this is an important decision. Parents should be getting their children vaccinated. That's the best way to keep them safe.
Dr. Adalja, thank you very much.